As to whether this is the right time, actually no, this is not the right time. The right time was several decades ago, in which case we would not have been in the position we're in now. Would have been much better prepared to deal with the pandemic. So the fact that we are late to this exercise does not mean we should make it further late. I think the area of public policy in which there is a widespread failure to appreciate its importance is universal health coverage. Everybody knows education is important and the government has a big role in that. Everybody realizes that crime is important and we have a whole security apparatus. But the importance of providing basic health coverage to your population is not widely appreciated. The benefits are not only to the individual, because it makes the difference between being tipped from vulnerable into poverty, often permanently. Secondly, the externalities to the wider society are enormous in allowing individuals to invest better and have a more productive economy. And one we just discovered over the last 2 years, which is when you have the health infrastructure that universal health coverage gives you, then when you have crises like pandemics, that infrastructure is in place for efficient delivery of the solution. So we need to recognize the importance of basic universal health coverage and to engage in this exercise to find a way to finance it efficiently and effectively. I have received a draft of the terms of reference, and not to bore the audience with too much details, but it is to deliver a report which is going to identify what is the most efficient model to deliver basic, nearly universal health coverage and how it should be financed.
Is it that primary user fees, for example, the removal is protected by that?
So you're asking me 1 month into the process what the findings are?
Okay.
A little premature.
And the second thing is, why should Jamaicans take this review seriously? I mean, we've heard all the members of all our guests here talk about what we know 10 years ago, 15 years ago. So what is an additional report on other reports? What will it do?
When you look at every measure or indicator under this area, which is the quality of care that people get, the number of Jamaicans who don't have access, the cost of the relatively poor outcomes that we have, the country scores poorly. So it is therefore impatient of debate that this is an area that we need to organize to deliver better in a more cost-efficient way. Okay. And that's the purpose of this exercise.
What's the deadline for the submission of the report?
We conceive of getting it completed in 12 months, and we started 1 month ago. As to whether this is the right time, actually no, this is not the right time. The right time was several decades ago, in which case we would not have been in the position we're in now. Would have been much better prepared to deal with the pandemic. So the fact that we are late to this exercise does not mean we should make it further late.
What's the composition of the review team?
Well, I was contracted, and it is my obligation to structure how the work is done, how I see fit. What we have decided to do, myself and the lead researcher who is at the end of the table, is in addition to having a research team who's gathering the data and doing the analysis, we're going to set up an advisory committee to sort of oversee that we are using the right methodologies and bringing all the relevant questions to the discussion.
I've allowed Dr. King, having known him for a while and worked with him, I have full confidence in his capacities and his intentions to do it the right way. So I've allowed him the flexibility of once and plus he was involved before, but he was chairing a committee that dealt with health insurance. But the conversation that hopefully will evolve over time is that we maximize participation, because this is not just about key stakeholder interests, it's about the country. And I would like at the end of this process, every Jamaican, or certainly the overwhelming majority of Jamaicans, understand the relationship between their decision making and how it will impact them in terms of their health status and their ability to afford it.